I'd like to invite you all to take a few deep breaths with me. In, out. In, out. In, out. Most of the time, breathing is something that we do without even thinking about it. We live and we breathe on these lands. But what's in the air that we breathe? Is it clean and healthy? Is it polluted? And what can we do about it? These are some of the questions that we're going to be talking about tonight. I encourage you all to listen with an open heart and an open mind, as you may hear perspectives that are different from your own. I ask that everyone be respectful as we listen to the Indigenous land defenders and healthcare professionals that have travelled from across BC to join us this evening. I forgot to introduce myself. My name is Tracy Saxby. I am one of the co-founders of My Sea to Sky, and I am currently its executive director. And with that, I would like to introduce Jackie Williams, Tiatanau, who is a Squamish Nation elder.
Good evening, everyone. I have my feather with me this evening. It's the eagle feather that was gifted to me from my husband, Henry Williams, and my son beaded on the feather for me. They say that the eagle is the closest that we can get to the Creator. And we usually use it if we're in a talking circle, and it grounds us. So I have my feather to ground me this evening. Cha minwaha tinsiai, tiautanat kwishamansna. Welcome to Squamish Okameo territory. My Christian name is Jackie Williams. I was born and raised in Squamish. My late father, a hereditary chief, Siamption Richard Billy Sr., my late grandfather Moses Billy, who passed the hereditary chieftainship and ancestral name to my father. My late great-grandfather Dominic Charlie, who lived in Capilano, spent a lot of time up here, hunting, fishing, sharing the history of this land. He taught our families the legends, traditional songs, and dances. I recall as a young child that Dominic Charlie came to our Brackendale Elementary School to drum and sing to our Squamish children and children in the schools. My dad, grandfather, and great-grandfather all worked in the logging industry. Both my dad and grandfather worked on the water in Squamish as boom operators. I have lived in Squamish, Wewacum, and now reside in Yaquapsum. I am a descendant of the original peoples of this land. I need to let you know that the hereditary chiefs were protectors of the lands and territories. They had to care for their families and peoples. We are rooted in many territories throughout BC, Canada, US, and beyond. My heart hurts when I see what is happening now, where the resource industry, whether it's oil, gas, mining, that has directly affected my people in many ways. I'm so very worried about the flaring that will be happening because the toxic fumes will just sit in the Howe Sound. What will that do to Britannia, Squamish, downtown Squamish? Squamish in our language means mother of the winds. What are the toxic fumes going to be taken? Where are they going to be taken? From the winds. And the mountains around us that protect us, the fumes is just going to sit in the air. I would like to thank My Sea to Sky for hosting this event to raise awareness about the health impacts that each and every one of us who lives in Squamish and surrounding areas of wood fiber LNG facility. I would like to thank the Canadian Association of Physicians and Nurses for the environment for the latest research on the health impacts of the resource industry, such as wood fiber LNG. I'm so very happy to see you here tonight, as that means that you are concerned about what the future holds for us with the completion of WLNG. More importantly, how will it affect all of our lives? I am here to let you know that while I am a member of the Squamish Okameo, I have been against this since our elected council of the day in 2014-50 came to our community, Squamish, and just wanted to let us know about wood fiber LNG. And I just want to let you know that Squamish is one of the oldest villages in our territory. At that time, our people spoke in opposition to this. But we all know what the resource industry does to our people. It divides communities. It waves the dollar sign, creation of jobs. But what is that? What are we going to be dealing with, 10 years from now, 20 years from now? I am of the belief that we must protect the lands for future generations. We are living in a time where we value the economy at the cost of health, not only to humans, but to the waters, such as the house sound, the animals, the environment, the plants. We are in a climate crisis, and it's up to each and every one of us to ensure that we're going to be good stewards of the land. What can we do to keep this beautiful territory pristine so that the future generations can enjoy for millennia? Thank you for listening. Hoi chika.
Thank you, Jackie. I'd like to introduce you all to Dr. Tim Takaro. He is a physician scientist at SFU, a professor emeritus in the Faculty of Health Sciences and Planetary Health, lead in the New School of Medicine. He's an active member of the Canadian Association of Physicians for the Environment. He's father to Annie and Ben, and life partner to Aggie, living in gratitude on Quaket unceded lands. His career began at the University of Washington in occupational and environmental medicine, where he researched the links between human exposures and disease, and finding effective public health-based preventative solutions to such risks. His current research program explores the impacts of resource extraction on human health in relationship with our lands and waters. With immense gratitude to the First Peoples, he is beginning to use Indigenous knowledge to relearn environmental health as he tests different interventions in climate action and planet protection. Tim, if you could please join me.
Thank you very much, Tracy. It's a pleasure to be with you this evening. Not checking my texts here, but just making sure that I stay on time. So, with the first slide, this is Frida Husson at Smithers with Canadian Association of Physicians for the Environment, speaking about LNG and the impacts on community health and the nation. This is back in September. Canadian Association of Physicians for the Environment is an education and advocacy group that's been around now 27 years. And we are now deeply engaged in planetary health. Next slide. What I want to talk about today is fracking and LNG and the overall impact. We need to think about what's happening here in Squamish, in your community, of course, but it is also in the context of everything that is connected to this plant. And that means the fracking zones in the Northeast, the pipelines running through the province, the facilities that are liquefying this gas, and also the entire world where the greenhouse gases from burning this fuel is changing our climate and our way of life. The climate emergency is here. This is the Coldstream wildfire in 2022. 2023 was an even worse year. We are going to continue to see increases in wildfire because temperatures are climbing and we have an enormous fuel load in our forests. This is a heat map describing temperatures from the beginning of the industrial age to the present day. What you see here is an average of the cooling being blue, which is compared with 1960, and the red being hot. You'll notice that the hottest years are here, but I will tell you the hottest years are still to come. The reason I know this, because I'm really old. I was born when CO2 was 313 parts per million. We are now at 431 parts per million, and the steepness of that curve continues its upward course. Next slide. I was a senior author on this report in 2022, The Health of Canadians in a Changing Climate, where we noticed with the research of others who had come before us that, of course, we have health risks that we're seeing. We've seen devastating heat dome here in British Columbia, additional heat deaths since that time, flying under the radar, incredible floods. What this report shows, though, is that we have a choice. We have a choice between a world that is only 1.5 to 2 degrees warmer or a world that is 4 to 6 degrees warmer. That is a huge difference. It means thousands and thousands of deaths that we are choosing at this moment in time to enable. Next slide. These are some of the impacts that many of you have experienced. Loss of livelihoods, increased social economic disparity, food security problems, dangerous working conditions, crop damage, loss of fisheries, not as much skiing. But the most devastating health impact is, in fact, this one. And that is to the tune of 70,000 premature deaths in North America from the single year 2023. These numbers will continue to climb. Here's our opportunity. We are, whoops, actually that worked that time. We are here, and we are at this inflection point where we could be sending our emissions down, as we have promised to do. The British Columbia Clean BC Plan promised to bring these emissions down. But instead, what we are doing is further increasing emissions. We're making this choice now. So under Clean BC, we're supposed to get to net zero by 2050. What we've done so far is to cut 2.3 million tons of pollution, a small portion of what we committed to. With these improved LNG projects, we're going to increase our pollution to the tune of 10 times what we have reduced so far since 2020. Next slide. This one I'm going to need your help with because my arrow on the bottom doesn't go far enough. So thank you, Tracy. If you would just pass that through the audience so we can get a feeling for what is 130 million tons. So as I had mentioned, with the plants electrified, we will have 13 million tons. Actually, that's kind of a sleight of hand because if you're reducing emissions at the plant by electrification, that just means that you're going to send that gas overseas to burn it. The same amount of gas is going to go through. And instead of being used to power the compressor stations, it will be burned overseas. So where did that end up? Back there. That is 130 million tons compared with this very short line here. That's what we have chosen to send to the world. Next slide. So what is flaring? This is what I'm going to spend the rest of my time with, which I've already used up some. Flaring is a burning of excess gas. It's required. It's actually a safety feature. You can let the gas go as pure methane or a mixture of methane and other chemical gases, or you can burn it, and it's slightly better than just letting it go. But it is still quite dangerous. These are the 5 polluting flares that we see in the Kitimat flare, which is the one on the left. Not important that you know these names, but the point is that there are a lot of ways of sending these poisons into the air. We analyzed, using satellite information, 64 facilities around the world to look at their startup flaring versus their operational flaring. Because what the industry will say to you is that, well, you might see a big flare right now, but that's because we're in startup or we have maintenance or we have some other issues going on, and it's not during our normal operations. But if you look at all the other facilities around the world using satellite information and not the information that comes from the companies, you find that, in fact, the startup operations are 3 times more polluting than the routine operations. And these startup operations are not being authorized. They are as if it never happened. And now we're in that, this never happened in Kitimat for 2 years. Next slide. This is my colleague, Dr. Laura Monet. She is a professor in engineering at the University of Victoria and has led the research on flaring here at Woodfibre. We're modeling what could happen. In the next slide, we have shown, as I mentioned, that this operations around the world have flared much more in the startup period than they are authorized to, than they say they will, and that they even say they are doing, because what they report cannot be verified by the satellites don't lie. The thing about, we can get into satellites in the question period, perhaps I don't want to get too in the weeds here, but my point is that there's a lot more flaring going on than the companies admit to. Next slide. So these are routinely underestimated. And the risk assessments that are done completely ignore the startup period, as if it's not happening. So what are the main air pollutants? These are listed here, the most important ones. Notice methane is not on this list. What gas is mostly is methane. If it were pure methane, then we would not have any problem. Because if you burn pure methane, you get water and CO2. That's a big problem, but it's not this toxic problem. So speaking of toxics, so the list there was nitrogen oxides, sulfur oxides, benzene, other carcinogens, and particulate matter. Our gas here in British Columbia from the Montney Shale primarily is some of the highest benzene containing in the world. Benzene is a potent carcinogen. It was the first chemical carcinogen ever listed, known as Class 1A. The flare in Kitimat goes up to 95 to 100 meters some days. Since February, the residents have been notified 33 times that the flare was going off. This is not routine flaring, even though they are supposed to be in routine operations at this time. And Ankur will be telling us more about what life is like under that flare. Next slide. LNG Canada has been flaring at least 15 times more gas than they were authorized to flare. The flare is malfunctioning. The so-called warm, wet flare tip needs to be replaced. Have they stopped? Anyone know? No, they have not stopped. It will take 3 years to fix. Meanwhile, they're going to be flaring 40 to 60 times what they're authorized to flare. We have seen the first reaction, finally, from the BC Energy Regulator. This is after 7 months knowing that the flare was malfunctioning. Last week, they finally released the first citation. The citation was for black soot, not a component that I would go after, although it is indicative of incomplete combustion. It is important to control it. But they were given until August 15th to report on what was happening, and another 2 months to do anything about it. That's too long to wait when human health is at risk. What are these risks? Asthma is one you will hear about from Kitimat residents, and that is because of the particulate matter, the nitrogen oxides, and the sulfur dioxide. All of them contribute to asthma. Heart attacks are also connected with location near these facilities, preterm birth, certain cancers, again associated with compounds like benzene, and overall early mortality. These are cited in a study of US facilities where flaring is occurring. And of course, there is a human health cost beyond the pain and suffering of the humans. Our health system is profoundly impacted by these illnesses to the tune of nearly $1 billion for this report from some LNG export facilities in the Louisiana coast. It's not just the US, of course. This is reporting from Australia. And another example of where trusting what comes out of the company's mouth is very hard to swallow. Why would they have to revise a number by 13,000%? Can anyone recognize this? No one. I think you do. Okay, so this is a mock-up of the wood fiber LNG facility. And I just want to draw your attention to the flare stack, 140 meters tall. The idea there is that the taller the stack, the more likely you can get it out of howe sound. I would put to you that these mountains are somewhat higher than that. Next slide. This is the plant under construction a few weeks ago. You see here, whoops, it did work. This is the compressing facility. The stack is being built here. Yeah, these cruise ships came in. I don't know what they would be doing there. Next slide. Not the place I would prefer to cruise to. Next slide. So this is what we hear from wood fiber, that the flaring will be intermittent, 3 to 4 days, that startup will be only 1 month. I'll remind you the Kitimat startup is still going, even though they say they're under routine operations. They're behaving like startup, and it's now been 2 years. Next slide. What wood fiber does say is that there will be about 3% of the time will be flaring. That means 262 hours or 11 days. But if they do that little, it would be amazing. It's going to be much more than that. I can't predict, of course, what exactly the flaring will be, because they can't either. Next slide. This is the study from Texas that shows an increase in premature births. But if you lived within 5 kilometers of a single flare that flares only 10 days per year, the premature birth rate increases by 50%. Just to remind you what the distances are we're talking about, right in the same wheelhouse. Next slide. So this is the big variable. We can know pretty much what will come out of the facility once it's flaring. What we can't predict is what everything else that will be happening around it. In other words, what will be the inflow and outflow from the sound? What will happen if there are wildfires around this area and air gets trapped in the sound? What will happen under inversion conditions? These are things that no one controls. Next slide. So we wanted to get ahead of the game. That's the purpose of this study that I'm doing with Dr. Monet. And our idea was get information about the flare design, use the data that we've gathered from around the world, all the other facilities, and make a model. And tell this model that we want to understand what would happen under worst case conditions, what would happen under best case conditions, and what would be kind of a middle ground. Well, I'm sorry to say that we're not able to conduct this study because the regulator and the province, the Environmental Assessment Office, does not have the flare design information. At least that's what they're telling us. They are required by law to know this information before they authorize the construction of the facility. LNG Canada, of course, knows what the design is. They're building it. They won't tell us. So we cannot make our model and do the prediction that we would like to do, even knowing what has gone wrong in Kitimat with the flare. How are we to know that that could not happen here? And if we did know before the factory became operational, would we be able to stop it? Or would they say what they have said in Kitimat, which is, well, it's too bad, but we can't get the part in there and for 3 years, so you'll just have to live with this additional pollution 40 to 60 times what is authorized. So yes, we are worried about LNG in Canada, and in British Columbia in particular. As I mentioned, worked with the Canadian Association of Physicians for the Environment and the Canadian Association of Nurses. This is my lovely wife, Aggie, and the incredible firekeepers in Tara Marston who have been fighting tooth and nail to keep their communities safe. LNG is harming us at the very beginning, in fracking, along the way, in pipelines, in liquefaction facilities, such as being constructed here in wood fiber, in shipping. All of this is leaking methane all along the way, one of the most potent greenhouse gases. And then, of course, in the final consumption of all that gas. Where did that gas go? It's off in the ribbon somewhere. But every step of the way has health harms associated with it. And I just want to finish with this idea that we need to know what that is. And fortunately, here in Squamish, the City Council has asked this question: what are the health harms potentially of the industry? They have backed the Health Officers Council of British Columbia, Canadian Association of Physicians for the Environment, Canadian Association of Nurses for the Environment, in determining what the health harms are all along this chain from fracking to consumption. So I just like to thank the council here. I'd like to thank all of you who came out tonight, and I'm happy to answer questions at the end when we get our panel going. Thank you.
Thank you, Tim. Right. Our next speaker is Ankur Patel. Ankur Patel is a registered nurse residing in Kitimat located on the traditional territory of the Haisla peoples. Receiving his education in rural northwest BC and providing care in the region provides him with insight as a local healthcare provider in an LNG-facing community. He has also served the field of nursing nationally and internationally via his tenure on the board of the Canadian Nurses Association, his current position supporting the International Council of Nurses, and as an active member of the Canadian Association of Nurses for the Environment. If you can please welcome Ankur Patel.
Oh, yeah. Well, my name is Ankur Patel, and I've come down today from the home of the Haisla territory, Kitimat, BC. And, you know, just to paint the picture, I'm a nurse in Kitimat. So I'll get you to go to the next slide for me. Beautiful. So this picture kind of represents some of the work we do here. This picture of me out in the Smithers Town Hall, organized by CAPE in September, working alongside land protectors, physicians, and other healthcare providers. So the Canadian Association of Nurses for the Environment is an association that really holds the belief that we need to advocate for our environment and our patients together. It's actually our ethical underpinning as nurses to do so. We need to safeguard all conditions which kind of result in our patient outcomes. So I'll get you to go to the next slide. Beautiful. This is our president talking at the House of Commons, speaking about banning greenwashing of fossil fuel ads. Next slide. So I want to start a little bit kind of zoomed out. I want to look at your healthcare. What is the picture that you're seeing? What is the provincial outlook looking like? So here you'll see a bunch of smiling nurses who are extremely passionate. And let's start with the nursing picture. I want you guys to kind of see the pictures that we see as nurses and how this affects the care that you deserve as Canadian citizens and residents of your community. So starting by staffing. We are seeing that our hospitals across the province are chronically understaffed. We do not have enough nurses to meet your needs. This is a baseline understanding and something that we're working to rectify across the province. So we're facing a shortage of nurses. The nurses who come into practice, they're not feeling safe. They are having issues of violence, escalating violence across this province. You'll see it across the headlines. So those who are coming in already feel unsafe to provide the care that they should be doing. And, you know, eventually all this leads to a cycle of burnout and attrition of our healthcare providers. The nurses, we don't have enough of them. They're facing violence, and we're losing them in such a rapid scale that we cannot reproduce our healthcare providers in an extent to actually meet your healthcare needs as Canadians. So here, next picture. So now here's the second piece. I want you to kind of understand what the picture looks like for you. What is the impact on you as residents of our province, those who will interact with the healthcare system in your worst moments, your families, your friends, people around you? What is the picture based off this? So wait times, we're seeing wait times go up across the province. I'm sure you guys are well aware of this. 8 to 12 hours entering your ER. You're seeing that your surgical appointments are being pushed back months or even years. The hip replacement, the heart surgery, anything that requires that level of care. We don't have the staffing to meet your needs. And then we're looking into a lower quality of care. It's a simple equation. We don't have enough nurses. How can we address your care in a rapid manner? This may be missed assessments, medications not put out on time. And, this could be in the picture of missing a stroke, not seeing a heart attack or sepsis or deterioration of your conditions, your family's conditions. And, one thing that is especially salient right now is that the nurses are approaching a strike vote. We are having worsening conditions across our province and our country, and our negotiations are breaking down. So not only is this picture here, but you may be facing even worsened or lessened access to healthcare. So this is a worrying condition that we're already seeing. Next slide. Now let's add another variable into the equation. So with the two pictures earlier, I want you to think to yourself, do you feel comfortable accessing healthcare, especially right now? Is this something that you feel like your families, your friends, everyone around you could necessarily rely upon? Now hold that for a moment. Let's add another variable, flaring. What kind of picture will this add? I feel like I don't need to explain it at this moment because Tim explained it so well. We are seeing that these flaring, the LNG industry across Canada and across this province especially, this is resulting in health impacts. This is worsening the strain on healthcare providers. This is worsening the strain on our healthcare system. And especially our vulnerable populations, our mothers, our children, our elderly, your parents. they feel this the most, and they're the people who will be accessing this care more often. Again, a very vicious cycle of requiring more and more healthcare resources to meet this need and more staff usage. It's a hard picture right now. And, spend some time thinking about this. Sit at home, talk with your family and friends. What's the end result? You're already facing a precarious picture. How will this be affecting you as, LNG industry is entering your backyard as it has entered mine? So now I want to step back a little bit. I want to talk about myself a little bit here. I'm a registered nurse. I grew up in Kitimat, BC. I received my health education there. And what you see as a healthcare provider in like a rural or northern community is that they heavily base the education and understanding on your picture of the land and your people. You understand the land being the ultimate determinant of the health of your clients. And what they really train you to is to understand what your communities are facing and to work to elevate their voices. So this is a bit why I'm here today. And so we kind of got into the game a little bit early, but that works well. So on the left here, we have a picture of me strolling across the community. And we'll kind of do a quick back and forth. I'll show you a picture, and then we'll go to the next one. And we'll see if you can kind of tell the differences. So here, a little bit stroll in my backyard. And, this is the life of a regular community member. You're able to walk across this community, but now you're kind of seeing a giant flame here. Let's see if I can figure out this laser pointer. You guys see that? Do you notice that in the backyard? Isn't that interesting? Like, you're strolling around downtown. What's that? Here, we'll go to the next one. So here's another picture I took. This was on Heisla Hill. It's a beautiful outlook on our community. We have some cars here, trucks. Our sprawling community in the background, and you can see the expanse of the wilderness, our mountains. It's amazing. This is my home. This is the place that I love to live in. This is where I've grown up. Here, let's see if you can notice anything there. Is that interesting? Kind of right in your communities right here. What's this? This is something that the residents of Kitimat call the Eye of Sauron, because it is massive, it's booming, extremely loud, and tossing black smoke into our community. Isn't that interesting? Think if you're a mother. Think if you're a young child. If you're a community member who's been living here your whole life, how does this impact you? How will this impact you as this enters your community? Here, we'll do one more quick one. We'll run through it real fast. So here we have the Chalet, a little bit of a fancy restaurant in our town. Let's say you're dressed up, you're out with the family. It's a little bit in kind of the heart of Kitimat. And here, let's see if you guys can tell the difference. So, what's going on here? I'm trying to enjoy a night out with my family. I'm trying to eat some food. And it looks like there's a huge pile of smoke kind of emitting in the background. I sure am going to enjoy my steak and burgers right now, right? So here, let's go to the next slide. So here's a little bit more photos. I want to give you a chance to kind of breathe in Kitimat, a chance to understand what it feels to live like in the community. So a little bit of a collage coming up. So you'll see, again, so many different angles, so many different perspectives, but you'll see how close it is to your community, your way of life, kind of how it affects everything. Here, we'll go next. This is the alert that we get. So I actually get text messages sent to my phone when the flaring is going off. And, oftentimes these text messages are sent after the fact, after the smoke is emitted, after we're seeing light pollution, noise pollution, everything. So, it's really funny. I was exploring your community. I took a bike ride. I went all the way down. In the middle of this bike ride, I get a text. Kitimat is undergoing more unplanned flaring sessions. This is actively going on. This is going on as I'm speaking to you right now, and they've said it will go on for days in that message. Next. Here's another photo I took. It's kind of like the sun. It's a never-ending night, or never-ending day. You don't really get to experience too much night in the town of Kitimat here. Next. Now this one, especially on cloudy nights, you can see it from a town over. It is absolutely astounding how this torches up your night sky, how you don't get to experience night anymore. And it's loud, it's booming. I'm trying to paint this picture as strong as I can for you, because this is what might be your reality. This is what you guys will live through. This is what my people, my communities are living through. So here, we'll go next. Another one. Okay, we'll go next. Perfect. Sleepless nights, talks of smoke. People are feeling the concerns. And what I want to kind of dig into a little bit right now is what our community members have been saying. And this is a subsect of our community that's been confident to speak publicly about this. So we'll run through a few quotes. If you can hit the next one. Even this morning, it was like 75 to 80 decibels inside my bedroom. We got maybe 2 hours of sleep this whole weekend. I'm just useless now. Next. My backyard was covered in gray smoke when I was cooking hot dogs. You get the smell for a few seconds. It smells like burnt plastic or styrofoam. Next. Is there going to be, in 40 years from now or 30 years from now, the incidence of cancer going through the roof? I've been having like a cough, a runny nose, headaches at nighttime. My boy, the same thing. I'm at a wit's end with the noise and the smoke. I've built this house with my own hands. I dug the foundation, poured the concrete. I put everything I own, all my savings into it. Now I can't even sleep in my own house. My house was lit up like daylight, shaking from the noise. On top of that, there was an ear-piercing whistle. So this is what our community members have been saying. These are questions that they've been asking. As this develops in your community, I want you to kind of sit with yourself today. What questions should you be asking? What questions should you be asking right now before this is your reality? What questions does your family, your friends, your community members, what should they collectively be asking? Because my community is one that's forced to ask these questions. Are you going to ask these questions in advance before you have to? And to end my piece off here, I want to dig in a little bit of my experience as a registered nurse living in Kitimat. Like, what have I seen as a health professional? And how can this kind of show up in what your nurses will see? So we're seeing increasing symptoms. Those who are already living with pre-existing conditions, especially like asthma, heart conditions, they're saying that they're having increased coughing, difficulty breathing, lung irritations. It feels like their throats are closing up, especially those who are facing the worst of the worst. This is just exacerbating their symptoms. Increased reliance on medications. So there's a medication, a class known as bronchodilators. What they do is they open up your airway, and this is a necessary way of life for some people to exist, some people to live in this world because their respiratory conditions are so terrible at this point. So I'm getting members of both patients and residents alike who are saying they're relying on these medications more often. They're requiring on medications to open up their airways just so they can go to the grocery store, walk their dog, garden in their own backyard. They're relying on these medications more often. Do you have any members like that in your community? Any members who need these medications, who will be requiring more, dealing with this more often? And the most prevalent symptom is questions. Questions, where I'm getting so many questions every day. Should I still be living in Kitimat? How will this affect my pregnancy? How will this affect my parents? What are we doing? How are we not getting to the bottom of this? How are we not assessing this appropriately? And again, that's what I want to leave you with. What questions will you be asking? What questions should you be asking right now? How can you get ahead of this before this is in your community? Thanks, Tracy.
Okay. Thank you, Ankur, for painting a very vivid picture of what it is like to live in Kitimat right now. I would like to invite Gina Mowat and Shaylin Sampson to join me right now. Gina Mowat is a member of the Gitxsan Nation. Along with their work as a Lakip firekeeper, Gina is a registered clinical counsellor and holds a PhD from the University of Victoria School of Child and Youth Care. Shaylin Sampson is a Gitxsan Lakip firekeeper, artist, and media and communications operator. They have been on Indigenous frontline since 2019, protecting Gitxsan and Wet'suwet'en territory from imperialist resource extraction. Please welcome them both to the stage.
Simgiat Sigidam Hanak Gangabaluksa Luamfgodi Wingetan. My name is Shaylin Sampson. I come from the Gitxsan Nation, from the Lach Gibu, which is the Wolf Clan, and Wilpspoch, which is the House of Spoch. I grew up in Hegelget, which is a Gitxsan and Wet'suwet'en village in so-called Hazelton, underneath the mountain called Stickyoden. And I've spent the last 7 or 8 years on front lines, fighting for Indigenous rights, and standing up to industries like this. I spent about 5 years on Gidimt'en territory fighting against the Coastal GasLink pipeline, the pipeline that's supplying the gas to the LNG facility in Kitimat. I was arrested multiple times for my work as a land defender, and just finished up court this year from the arrests in 2021 while we were fighting Coastal GasLink from going underneath the sacred headwaters of the Wet'suwet'en. Gina and I both are doing work with our collective called the Firekeepers on Giksan-Luhk'yip. It's a collective of youth under 35 that live on or are traditionally from Giksan-Luhk'yip. And we've been doing a lot of work in our community, raising awareness about a pipeline that's proposed to go through called the Prince Rupert Gas Transmission. And we are just in the starting phases of this fight, even though our nation has been doing this fight for a long time. It was originally proposed in 2014, and yeah, there's a lot of work being done, but I'll just let Gina introduce themselves first. Oops, sorry.
Simgiget sigramana gan gwywils nidzachom laxliksta wai laxel pediki. That's my bedtime alarm. It's kind of embarrassing. Yeah, my name's Gina Mowat. I am part of the Luhk'yip Firekeepers, and been close with Shay for many years. Also arrested at the Ministry of Energy, Mines and Petroleum Resources in 2020. And Shay and I were a part of a group of youth that occupied the legislature in Victoria for about 3 weeks. And also been involved in work within our nation. And I think that's all I'll say right now.
Yeah, so I just wanted to talk a bit about why we resist as Indigenous people, why we resist against industry and the importance of that and how it impacts not only our physical health, like Tim and Ankur were talking about, but it also is so tied to our well-being as Indigenous people and our spiritual health from being on the land. And I did just want to mention that specifically because I've been on the land, I know what it's like to heal on the land, and when these projects get pushed through and you see flaring like this, you really get disconnected from what your ancestors know as home. And even for the non-Indigenous people in our community, they can see what's coming down the line in terms of the Prince Rupert gas transmission based on what's happened on Wet'suwet'en territory. I think also just in the context of this Kitimat flaring, it can't be separated from the Indigenous resistance of the Wet'suwet'en to the pipeline that is now causing this flaring. There was over a decade of resistance on Wet'suwet'en territory. It caused the pipeline to be years late and billions of dollars over budget. And then it comes through, and they had environmental assessment issues along the way. They did get fined, but when they get fined, it's like pocket change to them. It doesn't mean anything. It's just the cost of operation, basically, to them. And so just looking at it now, where there have been Indigenous resistance, the Haisla did sign on to CGL, but they're the ones that are facing the most health impacts being in Kitimat on Haisla territory. And often as Native people, we get put in positions where it doesn't feel like we have a choice. So the Haisla are in a position where they've chose to sign on to this project, and now they're the ones that are gonna be feeling those long-term health impacts. And on Wet'suwet'en territory, we know what it's like to lose access to territory because of industry. And in the court case that I just finished up, the judge found that they breached Indigenous rights in 2 different sections of the charter. And so you look at companies like Coastal GasLink and Western LNG and Woodfibre and LNG, and all of these companies are acting in a way that degrades not only Indigenous rights, but when they degrade Indigenous rights, they also are putting all of our rights in jeopardy. Because when it happens to us, it's very easily could be our neighbors, you know? We knew when it was happening on Wet'suwet'en territory that it could be the Giksan next, and now we're coming up to that fight. So I think in a context like here and in Squamish, it's important to think about your position and your place in the struggle. It's really easy to look at Indigenous leaders and think that you just need to follow them, but it's really important, and I think looking at your own health impacts is a great place to do this from, but thinking about what is your place in the struggle? Why is this fight also yours? Because we've inherited this fight as Indigenous people doesn't mean that we're the only ones that have to do it. You know, we can walk together for this fight.
How y'all doing? Good, after hearing all that. Yeah, I just want to also acknowledge the territory we're on and thank Jackie and Henry. Really grateful to be able to sit with you folks over a meal and kind of share that sentiment. Jackie, you mentioned this like feeling of heartbreak, and I think that's like where our people are at. Yeah, we don't want to be here doing this, and we want to be on our territory doing beautiful work together and cherishing our lakyip and our families, but we are being thrown into another fight, and hopefully what we are sharing with you tonight can maybe like illustrate a bit of what may be to come for you folks. Yeah, so we've, as Giksan and all Indigenous people, I want to say on Turtle Island, but globally, have been fighting these projects and degradation of our homelands since the beginning of colonization. So like as Shay mentioned, like this, for us, this struggle is an unbroken chain since settlers arrived on our territories. And so every inch of territory that we still have and that is still pristine in this province is because we fought for it. And when I say we, I'm talking about, our ancestors as well. And our ancestors, chiefs from our nations, were sent from our territory down here to prison for practicing our laws and governance, which is in itself connection to territory and stewardship of territory. And we had chiefs die down here in prison for protecting our lands. And so this battle is, for us, something that we've sacrificed so much within our families, and like every single generation has a story like this. And even when we were, Shaylin and folks were fighting Coastal GasLink, our nation, as neighbors to Wet'suwet'en, blocked the highway, blocked the railway, and our chiefs were arrested again there. And that would be like your president being arrested. And I would say even more impactful for us. And so I also want to mention that, there's this kind of shock around how could Canada let this happen? But like I've mentioned, it has been happening to us for generations. And also Canada has been inflicting this violence, environmental degradation through violence around the globe for, since its inception. Canada owns 80% of mines around the globe, mostly in the global south or poor developing countries. And there's a report from the United Nations a couple years ago that came out that Canada is using tactics of slave labor, child labor, and violence in order to keep those projects running. And so in a way, it's Canada's violence is coming back home because these projects around the globe and in our territories where marginalized Indigenous people face the consequences, those projects have been for the benefit of all Canadians. And so now the projects coming to Canadians' own back door, it's a coming home. And I think that requires all of us to ask, what does that mean? And I mean, an answer to that is like rejecting Canada's violence in all of its forms, because, you know, we know that we can squash PRGT, which is our battle, or wood fiber, but Canada's going to churn out another project. And like to mention this as well, is like these projects are connected to a system of global imperialism that relies on violence. And we have to be in solidarity with each other. And our resistance here, wood fiber, is connected to PRGT, is connected to projects around the world. So we're kind of advocating for like a multifaceted approach to resisting this project in a way of like coming home and asking like, what does it mean to be Canadian, and what does it mean to reject Canada's violent projects here and elsewhere? I think that's all I'll say.
Yeah, I guess I'll just kind of bring it to our calls of action. And I feel like a really important part of doing this work and understanding like who you are in this fight is also taking a look at the context and the history of where you are. Understanding who are the native people of these lands, who's traditionally stewarded the lands that you live on. How are you benefiting from the degradation of Indigenous stewardship of land? You know, when we were out on the Yinta, my older sister would always say that when you've been here for a couple of weeks, because so much of your body is water and you've been drinking water from the river, from the Wedzin-Kwa, then a large part of your body is from this land. You know, a large part of your body is water from that river that we're fighting to protect. And so I just urge for people to find that here for you, like what is worth fighting for you and for your family and your future generations. And to think of this place that's so populated and there are wealth in these areas, what can be done here to stop this project? What can be done to benefit Indigenous people's rights elsewhere? And what are you willing to sacrifice? What are you willing to give? Because Gina and I do this work and it becomes most of our life, you know? It becomes what we think about every day, what we think about for our nieces and our nephews that are growing up, our families, our siblings. And, you know, it's really intense to be in places where industry has taken over, but we've known that feeling for generations at this point. And so the fact that it's coming to urban areas, I feel like people are really starting to understand what that means for them. And just, it's important to think about the people that are working in these facilities that are the working class. It's really integral to remember that we're all victims of capitalism. We're all forced to live in this system where we don't have enough money to survive, we don't have enough money for medicine, and all of these different things. And so it's really integral to remember that lots of people, including our families, are working for industry, and we have to come to a point of understanding of why that's happening. But we also need to attack the people that are at the top of this, the 1% that are benefiting, the people that are invested in the pipeline that's slated to go through our territory are in Texas. They're investors in Trump's campaign. And so just think about for yourself in this region, what is your leverage? How can you use that to your advantage? And how can you protect yourself from projects like this?
Thank you, Gina and Shaylin. So I'm going to speak a little bit about what you can do and what we can do together. First thing I want you to do is to take out your phones and fill out this survey. It'll take about 2 minutes. If the QR code doesn't work for you, just do myseatosky.org/survey. Sorry, I should have had it on the slide. Yeah. So I want to share a message from a fisherman that lives next to this LNG terminal in Louisiana. He said that my advice to the communities where these things are coming, try to stop them. Because once they get rolling, the flaring doesn't stop. and they get to make up the rules as they go. People power works. It has been working in this community for 12 years. We have very successfully held Woodfibre LNG and FortisBC accountable. We have made them reach higher standards than they would have otherwise. We have forced them to move compressor stations, to move the pipeline route, to switch to electrification, to change from seawater cooling to air cooling. We are holding these companies accountable through the courts when they are failing to follow the law. And that takes all of us. That is the people power that is in this room and the people that have been standing beside us for 12 years now. So some of the actions that you can take as individuals, there are little flyers that are on all of your chairs. There is a petition that we have been collecting signatures on for over 12 years now. Please sign that petition. We have nearly 26,000 signatures. What that petition allows us to do when we are engaging with different levels of government, it allows us to show the power of the people and the strength of opposition to these projects in the Alcatsim Howe Sound communities in the Lower Mainland. The other thing I would like to ask you to do is to send a letter. All of these links are on this handout. So we are supporting the call by the Canadian Association of Physicians for the Environment and the Canadian Association of Nurses for the Environment for a cumulative independent health impacts assessment. Please take a moment to send a letter. There's a template form that you can use, but if you want to customize it, that is really powerful as well. The Canadian Association of Physicians for the Environment and CAPE and CANE, they also have a petition or letters that you can send through this site called protecthealthfromlng.ca. Please support the actions that they have. You need to engage with your MLA. You need to talk to your MP. They are our elected officials and they represent all of us. Send them an email, make a phone call, drop in at their office, talk to their staff, set up a meeting with them. If anybody wants any support on how you can do that, please reach out to us and we can train you. It can feel intimidating, but I want to share with you from somebody that started doing this 12 years ago, you need to be engaging with your electeds and let them know how you feel about this. Please volunteer. If you are a healthcare professional, CAPE and CANE are looking for volunteers. If you are a resident in Squamish, My Sea to Sky is looking for volunteers, and we have an incredible volunteer team. We typically have about 50 volunteers that volunteer about 2,000 hours, 1,500 to 2,000 hours for us every year. Sign up. We are going to be getting very active again. The other thing I would ask you to do is to consider becoming a monthly donor. My Sea to Sky, actually this is a fantastic image to show. This is where My Sea to Sky started 12 years ago, in this room. The people in this photo, many of them are my co-founders of My Sea to Sky. This is people power. This is how this starts. This is a movement that will build and will become so powerful. If you think of it, we are like a river that is unstoppable. But you all need to be a part of that. You need to be a droplet of water that joins me so that we can stop this project together. So if you can, please consider becoming a monthly donor to My Sea to Sky. Most of our funding comes from the communities around Alcatsim Howe Sound. We have hundreds of donors that contribute to us every year, and that is a large part of the funding that supports this work. This event, for example, was supported by those donations, so please consider contributing to help support more events like this. The other thing that we are looking to do, we are looking at what is happening in Kitimat right now. We do not want that to happen here. And so we are setting up air quality monitors in Kitimat and in Squamish because the government is not doing their job to protect public health. We know this. So we are going to do it for them and report on them and hold them accountable. One of the things that we're hoping to do is to purchase a BTEX monitor, which will measure benzene and ethylene and all of these other things. So to do that, we are hoping to raise $40,000. This is a small amount of what we actually need. These monitors, how much do they cost, Kate? 100,000. But we are working with the University of Victoria. We're applying for some grants through the University of Victoria, and we're hoping that we're going to be able to get that. But as the community group that is working with UVic, this is the amount that we need to raise. So I ask all of you to please open your wallets and contribute to that so that we can measure benzene, which is something that is not measured by the government. And with that, I would like to invite all of the speakers back up to the stage. We're going to have a bit of a Q&A.
Thank you for being a nurse in Kitimat, and thank you for taking your time to do this because it brings me to tears, as you can see. Very important to my heart and soul. My family still lives in Kitimat. And I hear all the time about the flare. But I'm curious if you are able to explain to us in a measurement of some kind, how much was LNG Canada flaring during the startup? Like in days or tons, or I don't know how you can measure it, and how would that compare to what we will potentially see? I know you don't know what their flare will look like apparently, so that's probably a hard question, but.
I have a difficult time kind of bringing it to life for you. I feel like the strongest picture I could tell is the statistic that we showed earlier, 33 times in 1 month having a flaring event. That is more than once every day. That's extremely concerning. And it feels suffocating. It truly feels suffocating, especially with so many residents I talk to. They can't go a day outside in their life and not feel this, see this, hear this, and have this kind of engulf the community that they loved. I'll take a moment and maybe pass it off to Tim, if he can speak to the technicals of this a little bit.
Yeah, I think the easiest way to think about it is the permit for Kitimat is for 8 meters squared. Think of a meter squared. 8 meters squared per minute is permitted. What has happened over the last several months, which is sometimes the industry calls it startup, sometimes it calls it operations, sometimes it calls it non-routine. So it is still startup, even though they have been operating for months. So take that 8 square meters and multiply it by 40. So that would be 320 square meters. That is the volume of gas that was flared on average for most of the end of 2025.
And in our case, they're saying now to triple production. I know they're different projects, but if they were to then triple production, would that triple as well?
Yes. This question of whether they are going to triple wood fiber depends on who you ask, what answer you get. So when the Minister of Energy was in Texas drumming up business, he said, yes, we're going to triple wood fiber's capacity. But if you ask an environmental monitor, they will say, well, no, you can't just do that. So the minister is saying one thing in Texas, which actually would be against the law if there are not further permits let.
Hello, I'm Ruth Simons. I'm with the House Sound Biosphere Region Initiative. And every time we make a presentation about the UNESCO designation of House Sound, we are asked, how is it that wood fiber LNG can be operating here? And our answer is always that, well, we'll hold them to a higher standard. And we have many eyes on the sound. I want to thank you so much for the work you do. It's been very emotional. I usually don't get emotional, so I do want to ask you, though, about your experience with the BC Energy Regulator, who we trust.
I think that's directed to me. Although I bet you have some experiences with the BCER as well.
Yeah, I wouldn't say I trust them, though.
Yeah. We have a big problem in British Columbia and actually across Canada with accountability for holding the companies that build these facilities to account. And the energy regulator is supposed to be doing that. I already mentioned to you that we are trying to get information about the flare design for wood fiber, which the energy regulator is supposed to know because they were involved in letting the first permit. The Environmental Assessment Office, part of the Ministry of Environment and Parks, also is supposed to know those details when they permit the facility. So let me just say this about the regulator. They are operating in cooperation with LNG Canada in Kitimat. This is the situation that I've studied the most. And what that means is that, so this volume of flaring being 40 times what's permitted was allowed to go on for 4 months before the regulator was even notified. Then it was another 6 weeks before the community was notified. So is that the kind of regulator that you want? They have been now polluting for 40 to 60 times what they're permitted to do for these months and months. And it was only last week when the first citation is given. It wasn't really even a slap on the wrist. It was more like a, would you mind writing us a report about what you've been doing, poisoning this community, by August 15th? And then, please, would you do something about it by October 15th? Is that the kind of protection you expect from a regulator?
Hello, thank you. My name is Glenn Campbell. I would like to thank our honored guests. You've been very informative. I'd really like to thank Tracy. There's a lot of people in this room this evening that were here at that very first meeting that we had in this room. Hi, Nicole. Good to see you. Ruth, big hug to you. Feel your pain. I have a question. I'm going to turn the tables a little bit. Tracy, thank you for bringing up the fact that you're hoping to buy an air monitor. The city of Vancouver bought numerous air monitors because of the Burnaby refineries and the things going on at Tilson and everywhere else. We have 3 councillors for the District of Squamish in this room this evening that I can see. And I would like to know if the District of Squamish is purchasing air quality monitors.
That is. Kate, did you want to speak a little bit about what we're hoping to do with the BTEX monitor. I want to introduce everybody to Kate. Kate she's an independent journalist, or a former journalist. And as a volunteer, she reached out to me and started asking questions about what is going to happen when wood fibre LNG starts flaring. And the reason that this event is happening this evening is because Kate started asking these questions and started digging into this research. So I'd like to just acknowledge Kate right now for all of her hard work as a volunteer.
Thanks, everybody. It's like that, my favorite line from that movie, Don't Look Up, is, I'm just asking questions. I will just speak very briefly about this, but I had the privilege in January to meet with Dr. Louise Woodward, who's an amazing pediatrician from Northern Australia, who has been fighting exactly this battle in Darwin for 15 years. She has seen rates of pediatric asthma skyrocket. And she's been deeply involved in lobbying the Australian government to improve care for neonatal departments, caring for babies that wouldn't have otherwise had care. Like, she's a literal Mother Teresa type of hero. And she told me two things that really stuck with me when I met with her. Number one was that she realized that she needed to raise the funds for a BTEX monitor, and I didn't know what BTEX was, but the B is the one you want to pay attention to. That's a really potent carcinogen, as Tim said. And we don't have a baseline for benzene in this community. And Tim told me that ideally what we want is like 12 months of baseline data before the flare starts, so that afterwards, wood fibre can't point the finger and say, it wasn't us, oh, it's coming from somewhere else. It's very easy in Kitimat for LNG Canada to point the finger at the aluminum smelter. However, not so in Squamish. Kitimat has always been an industry town. This is more of this was a logging town, but it's also now very much a resort playground with a huge, tourism industry, booming climbing industry. So, at some point, it also becomes about accountability and potentially compensation for the victims of there are going to be premature deaths in this community because of this air pollution if it goes ahead. That study that was up earlier, they found something like, an average of 10 premature deaths per LNG plant in the US. You're going to see potentially millions of dollars in additional burden and cost on our healthcare system. So at the very least, we deserve to know where our benzene levels were and where they are after wood fibre. And at that point, potentially there can be some accountability. So it's not going to be cheap. These machines the machine itself, by the time you kit it out and everything, is $100,000, and then you need volunteers who are willing to host it on their front lawns, and you want to take samples all over the place. So if anyone wants to talk to me about BTEX monitoring, I would love to talk to you about it. Just come find me later.
Are there any other questions from the audience?
Yeah, I would just want to add something about that, and that is that you cannot change what you cannot measure. And that's really the key point here. And also, it's benzene, toluene, ethylene, and xylene. BTEX.
And so, that was the first thing that she told me that really stuck with me. The second thing that she told me that really stuck with me is that after 15 years of watching what has happened to the health in her community, she is picking up and moving her family next year. She has 3 teenagers, and she's decided she's had enough. She has seen the rates of benzene. She has seen what's happened to the workers at the plant. She has seen increased deaths from suicides. We're talking about the workers now. Suicides, cancers, unexplained ailments, far above what you would normally see in the baseline of the population. So I thought that was very telling that she's leaving.
Good question.
Next question. Thanks, Kate.
Oh.
Hi, thanks everybody. Bob Porter. I have a major question for the crowd here. Do we have many people from Britannia Beach? This is a major community that is on huge growth with major plans. I mean, they're planning to build a whole brand new highway outside the village to take some pressure off the Sea to Sky. So I'm hoping that Britannia Beach is showing up for these events and are getting very concerned because they're even closer than we are.
Yeah. Next question. Or anybody have any comment on that?
Hi.
No.
I obviously, the work that My Sea to Sky has been doing is instrumental and foundational to the fight against what's going on. And I don't in any way want to diminish that. But I also look at our federal government that now has a majority government, which in some respects some people might like, you know. We have a provincial government who's doing what they're doing. And, you know, from a, I guess, devil's advocate perspective, I understand we have to do whatever we can. I mean, you said, are you asking the questions? And I guarantee you many people here have been asking these questions, demanding answers for 15 years. But again, when you have a federal government pushing this on us, when you have a provincial government from the beginning that hasn't listened to people in the Sea to Sky region, can you offer us any advice about how to fight these powers? Because as you were saying, this is a matter of fighting corporate power, right? This is capitalism 101, and we're against powerful actors, not only the corporations, but our own government. So we can, I'm fatalistic to some extent. We have to do whatever we can. But you've depressed me tonight, and rightfully so. Yeah. But again, what can we do in the face of our government? And to the south, we see it's not as extreme here as it is here, but we're facing the same kind of mentality in our governments. And what can we do realistically to fight those very powerful actors? Thank you.
I have to start off with a brilliant question. I'm so excited to answer this, but I don't want to take up too much of the floor to start off. I want to cede to Shay or Gina. Do you have any thoughts to push this off?
Yeah, I think, thank you for asking this question. I've been thinking about it as people have been asking their questions and answering back, thinking about like the regulator question, and even Kate, you mentioned about Kitimat always being an industry town. When actually, before there was ever industry on Haisla territory, Native people stewarded that land. And it was healthy and it was beautiful and there were food forests and we could survive off that territory. And same on our homelands, we have like food forests that would take care of us. And same with here on these lands, there's still a food forest nearby actually that Henry was pointing out to us earlier. The government and the regulators of the government and the regulators of industry, they're all created to benefit certain types of systems. They're beneficial to the patriarchy, they're beneficial to industry, to capitalism, and it just creates a big circle. And so it doesn't shock me when the energy regulator isn't regulating the flaring in Kitimat the way that it should be. It doesn't shock me when Indigenous people stand up, they're met with violence, they're met with the police, they're met with a wing of the RCMP that was created specifically to police Indigenous movements. And so when you feel misrepresented by the members of parliament or by the members of the Legislative Assembly, it is something that our people have known since colonization began in our homelands. We were pushed into reserves, we were pushed away from our homelands, from what we knew was safe, we were pushed into poverty. And so thinking about all these questions, I think it's like really important in all kinds of organizing and struggles to have multiple approaches that you're taking. And so doing the letter writing, doing the surveys, community organizing, that's all really integral. But often systems of capital don't listen to stories at the heart. They don't care when I talk about being worried about my nieces and nephews never tasting salmon. The regulators of BC's energy, they aren't thinking about that the way that me and Gina think about it, the way that our grandmas thought about it and their grandmas before them. And so often, and in our situations, we've had to go to things like direct action. We've had to go to the front steps of the legislature and occupy it for 3 weeks to even get a meeting with any minister. And our people, the Giksan and the Wet'suwet'en, they went to court for over a decade to fight for our rights. And even when they found that we had never extinguished our rights in title, they still pushed pipelines through our territories. They still pushed pipelines through Wet'suwet'en territories, even though the hereditary chiefs never consented to it. They utilized systems like band councils created by the Indian Act, which is a foreign government to our way of life. And so over and over again, we've seen our people have to take matters into our own hands. In 2020, when the Wet'suwet'en were raided, there was a giant movement across Canada called Shut Down Canada, where Indigenous youth and Indigenous people and supporters shut down highways, train tracks, ports, and it was an amazing moment. And for a second, we had the attention of the feds and of the province, and in those moments, they used that situation to basically stall the movement where it was. They said that we had signed a memorandum of understanding that people could stand down, they didn't have to blockade anymore, when really they hadn't agreed to anything about the pipeline or stopping construction or addressing the concerns. And years later, nothing on that memorandum of understanding has been followed up on. They've never done anything. And so we're familiar with this fight of not being heard and not being understood and being misrepresented. And I feel like non-Native people are experiencing that now in a way that they feel is really unfair, when really we've been going through that since colonization started. And often it means coming together with your neighbors, with people that are like-minded, and making it unignorable to the people in charge. And so I'd urge you to just look into the history of this place. There is a group that was arrested here called the Squamish 5, and I'm wondering if anyone knows about them, because they took matters into their own hands as well. And it's really amazing to look what people are willing to do when they're really willing to risk themselves and what they have for their communities.
I just want to add to that. I think that there is this really unfortunate collective amnesia around our history, both Native history, settler history, of resistance. And we were just we were just talking about this before, actually, around how do we have an 8-hour workday? How, our rights protected as workers is people rioted for that. And I think that history is erased and taken away from us for good reason. And I think that that learning that history is really important. And like Shay said, unfortunately, we don't have, the privilege to have any faith in government in the first place. And I think that again, just to echo what Shay has said as well, is you need to speak that capitalist language. They don't, the leaders, not to dehumanize folks in government or industry, but they are not acting from a moral compass. You can't appeal to the moral of capitalism, of money, and so you have to meet them at their wallet, and that has proven historically to get results. And like I mentioned when we were speaking, the reason we have anything in our nation, the reason we have any of our territory still existing, is because we met them at their wallet. We blockaded. It's a Giksan thing. If there's ever more than 2 Giksan together, people are there's going to be a blockade. But those tactics work. They really work. Blockade a highway. See what happens. Hit the government in their wallet. They will respond to you. You can call your whatever, MLAs, MPs, all you want. If you block that highway, or if we block the ferries, we block bridges, if you block their flow of capital, they will show up and talk to you. And we've had to learn that, and it works. And again, like, it is this, like, this history that does belong to us has been, you know, erased and silenced. And I think we all have like a obligation to learn that history and learn the tactics of people from all of our backgrounds that have done that work for us.
We've got time for one more question.
Sorry, if I could just super quickly interject. I just want to dig into what is power. Like, you mentioned being overwritten by your province, your federal state. It's making it feel like you have no autonomy in the matter. And again, I'm sorry for painting such a bleak picture of what life is in Kitimat. It's a beautiful community. But I want you to think about, what is your power? Where do you have leverage to kick off of, you know? As was mentioned, we have a municipal election coming up. I know there was a councillor who was quite vocal about this quite recently. Imagine your councillor loaded with 20 of these councillors. Individuals who know that this is what matters to the residents. This is what they want to see in the front lines. Your vote is your power. Think of, especially municipal elections, this is where you have the most say in how you kind of engage. So, you know, what are you going to do? Where are you going to express your power? And it doesn't even have to be with voting. What are you going to do after this event? Are you going to post on Facebook, hey, I attended this event. This is something I care about and something that I look forward to in the upcoming municipal election? Is this a show that you're willing to make to show that, hey, this matters to me, this matters to the people around me, and I will be doing action in that regard? Think about where your leverages are, even if it feels impossible. Think about where the minutia of power can be brought in.
Thank you.
Tim, I have a question for you. I obviously find it incredibly concerning that you're not getting the information you need to conclude your study. And what can we as concerned citizens do to help you get the information that you need?
Yeah, thank you very much for the question. You do have elected representatives. I would direct any inquiries to the elected MLAs from here. So Jeremy Vaglioretti is an excellent representative for this, and he's been very vocal in the legislature, but he needs to have letters sent to the Minister of Environment, Tamara Davidson, the Minister of Energy and Climate Innovation. Can you
Climate
believe that?
Solutions.
Climate Solutions, right.
So close.
It's a, and that would be Adrian Dix, obviously the Premier. There is a division within the NDP at the moment, and we should be exploiting that division. It was represented very bravely by Joan Phillips when she said, no, we will not undermine DRIPA. And there were 9 others that stood behind her anonymously. But nonetheless, that division is also present when it comes to BC pursuing a truly suicidal approach to our future with these new plants. And so they need to hear, those ministers that are sitting in cabinet with those portfolios need to hear, we've already received the grant money from the NSERC, the National Science and Engineering Research Council. It's not about money. So it's about pressure. I would agree and really honor the Gitxsan and all the Indigenous land defenders, because that is actually where the rubber meets the road. So these letters going off to the ministers, important. They can be very specific about the flare design, but I'm sorry to say, the way things are going, that's not going to be enough. And it will take people taking direct action, because that kind of action will discourage other investors. We didn't talk too much about this, but the energy minister, federal energy minister, going to Texas to say we're going to triple the size of wood fiber, that is a signal to everyone here that got to be making that very, very uncomfortable. Because if the investors feel uncomfortable, there is not going to be a doubling or a tripling. And we really have to stand up to stop this, because investors follow the money. And if it's risky, it would be just like Trans Mountain. You'll recall in 2018, because of resistance on Burnaby Mountain, in Blue River, in other places across the pipeline route, this Texas pipeline giant, Kinder Morgan, said, gee, this project is too risky for us, one of the biggest pipeline companies in the world. That was because of Indigenous people standing tall, other people on the front lines in Burnaby, and the investor said, gosh, no, we're out of here. And we had stopped that pipeline. It was only the fear of the Trudeau government that bought that pipeline that enabled it to go through. So that is the power of that we have. It starts with writing letters, but it ends up at the blockades, and in my case, in a tree, which I spent 16 months with many, many other people in the trees in Burnaby, blocking the Trans Mountain Pipeline, because all this other stuff, while important, you have to do it first. You have to, check the boxes, but you're going to end up on the front line if you really want to stop this.
And I think I would just add to that, we can't just have the investors walk away from this project. We need to make sure that our government doesn't take on this risky project with massive public subsidies. And even just locally, what we're seeing right now is that Woodfibre LNG does not want to pay their fair share in taxes. And this is why they have taken the District of Squamish to court. We stopped Woodfibre LNG from offering council $2 million in taxes in 2014. We said that was a joke because that was what the pulp mill was paying in 2006. So they need to be paying a hell of a lot more money to our community because of the impacts that we as a community are experiencing. So we cannot allow this dirty fossil fuel industry to de-risk their project by asking the District of Squamish for a deal on taxes. That is not acceptable. We've really got to wrap it up. We are so over time. Eric, can you keep it really quick?
I'd like to make a couple of brief comments on air quality monitoring and this BTEX monitoring installation. I'll try to be quick. So I am a standing District of Squamish councillor. Before I was elected councillor, I was a director of the Sea to Sky Clean Air Society, which oversees an air quality management plan for Howe Sound region. My colleague during part of this time was incidentally Ruth Simons. And we both shared frustrations, Ruth and I, over the, the priority that was given, or the lack thereof, to air quality monitoring and to our air quality.
Do you have a question?
No, I'm going to ask. Yes, I do have a question.
Can you please? Sorry, we really do have to wrap it up. We were meant to be wrapped up and out of here at 20 minutes ago.
Right. Well, First of all, local government used to be in charge of air quality monitoring, and they got out of it, and it was turned over to a nonprofit society. That nonprofit society, the local governments paid for. And Whistler and Squamish decided we're not interested any longer. We're not going to put any money into air quality monitoring. Mm-hmm. So that was its demise. It's about 8 years ago now. Mm-hmm. And so the first question I would ask is jurisdiction. As a councillor, I'm only going to speak for myself. I would not suggest we should pay for that. What's the jurisdiction? Who is asking the province? What does the province have to say about this? I was involved in the installation of the air quality monitoring station at Howe Sound Secondary. And it was costing quite a bit. And the first question I would ask to the province, so why can't you use that facility to do what you want to do with the BTEX monitoring? So that question needs to be asked. But the first thing that we need to do is address neglect. It's not only this air quality monitoring issue that's being neglected, there's others as well. So as my suggestion, the issue is bigger, it's neglect, and the questions need to be directed to the province, not the District of Squamish. We have no jurisdiction here.
If I could maybe perhaps speak to that. I really appreciate the perspective you take there because, again, it's a difficult equation in trying to get the outcomes we're looking for. And I would have to push back on that a little bit. I feel like the municipality is the voice of the people. You are the voice of Squamish. You are elected by the people of Squamish. If you are not representing their voices at these forums, how are you really... And sorry, I don't mean to direct this in you in any capacity.
We are happy as councillors to ask the questions, but we don't have the jurisdiction.
Exactly. So I'm asking, well, I guess I would say, what's the output? Is there a letter that the municipal government is making? Is there a forum that they're holding to show that the people of Squamish are interested in this? So instead of looking elsewhere, what can the municipality do? What can we act upon? How can we create change based off the people in our region? How can we represent them to the fullest extent? Because when you look at other areas, because yes, this may not be in your jurisdiction, but how can you make it your jurisdiction if people care about this? If this is a deciding voting factor, how can you bring truth to the voices of Squamish? I would have to say.
Yeah, and I do want to acknowledge that the District of Squamish did send a letter in support of the House
100%.
Officers Council letter.
So
we're very grateful to all of the councillors that voted for that, in support of that. Yeah. All right, we are really over time. I want to express deep gratitude to all of these incredible speakers who have travelled from across BC to share their wisdom and their expertise with us tonight. I am immensely grateful to each of you. There are still tickets available. I'd also like to take a moment to thank our partner organisations, the Canadian Association of Physicians for the Environment, Nurses for the Environment, and the Firekeepers. We could not have put this event on without you. I want to take a moment to acknowledge our incredible volunteer team who are going to have a very, very quick teardown after tonight. There are sign-ups at the front as you're leaving. There's volunteer sign-ups. There's also a petition you can sign up. Please take the actions that you have and please consider. So just to reiterate what Kate said, if you want to stay in touch with us, please take action, sign the petition, join our mailing list, send letters, and we will be continuing this conversation because it's going to be a critical one for Squamish. Thank you so much, everybody, for joining us this evening for this really important conversation. This is just the beginning of this conversation, and we're going to be in touch with more actions that we can take collectively. Thank you.
And thank you, I just want to thank Jackie again and Henry for welcoming us to your homelands. It's been really beautiful here. Thank you.
Thanks, everyone.